Hello students, this discussion forum whereby you are supposed to learn how to analyze data from this primary care survey. So to talk about the challenges, you really need to analyze the data. You have to look at numbers on these three tables. So for the first table, there are 86% of doctors working in the private sector. So very obviously that there are more doctors in the private sector as compared to the public sector, which is the polyclinics. Now, the second table, students most often do not know what is the market share. So market share here just means that patients, all right? So from here, the table here is that there are more patients in the private sector as compared to the public sector. And it's a good sign because in 2010, there are increasing number of patients going to the private clinic, right? Because there are more doctors in the private sector, so we do hope that there are more patients going to the private sector. All right. Now, next one is the chronic conditions. You need to know what is chronic conditions. We talked about it last week, so please check it out if you're not sure. All right. However, the interesting thing is that for this table, the number of patients with chronic condition is on the decline in 2010. So this is something that we want it to go up. Alright, this is what we want to achieve. So by understanding this data, the percentages that is shown here, you should be able to discuss the challenges faced in the primary care sector meaningfully. Alright students, for this group activity, you have to discuss the development in the primary care sector and help to reduce the overcrowding and long waiting time in polyclinics. As I've mentioned in the email that I sent to you on the last Friday, which is the day after lesson number 2, I did share that all the answers can be found in the 6P or the slides, right? And your job is to demonstrate understanding by elaborating on each of the points in the slides or the chosen slides that you can use to answer the question, okay? But I have not found a group that can really demonstrate a very thorough understanding of all the points in the slides that they have given. Now, I would like to go through all the points with you and to ensure that you understand it fully so that you can do well in an exam. So the first point is that the trends in the public and private partnership in primary care. So first point, which is talk about the flowing of more subsidies from public to private primary care. So what can you think of for this point? It is actually referring to CHAS, all right, the Community Health Assist Scheme. So patients who have this CHAS card, they would able to go to the GPs, see doctor at a cheaper rate, and it is to prevent the overcrowding of patients in the polyclinics. And the second point is that enhancing support for private practitioners. As we know that most of the GPs are run by 1 or 2 persons, so they are usually solo doctors in the GPs. And in order to get more patients to go to the GP, we need to give the GP more support by having what we call CHC, Community Health Centers, right? And do you know exactly what community health centers are? And if you do not know, it is okay. But to really demonstrate understanding, you need to do a bit more research on what exactly it is. Now I'm going to show you a website that you can actually refer to find out more about the facilities that is provided by the community health centers, and with these facilities, it really helps the patients in the GP. So this is the Singapore Silver Pages website, right? And it talks about what is community health center, what does it do, the process. So you visit a GP, right? And the GP identify that you need to refer you to CHC for test. So the CHC will conduct a test and send result back to your GP, and then your GP will review the result and follow up with you. So it is something to add on to the convenience for the GP and for yourself, because these community health centers are usually located near your homes. So these are the services that are provided by the community health centers, and the focus is very much on chronic diseases such as diabetes. That's what you can see. the diabetic food screening and diabetic eye screening here. Now let's move on to the third point, which is expanding the roles of private GP, such as treating patients with mental health and or need palliative care. So patients who need palliative care are usually at the towards the end of their life, and palliative care usually lasts about close to 6 months or less. And by expanding the roles of GP, in other words, the GP can do more, and such it will help to lighten the workload of doctors in the polyclinic. And for the fourth point is the capacity in the primary care sector. So we collaborate with the public sector, such as example would be the family medicine clinic. And this family medicine clinic also focus on chronic diseases. Remember the chart that you have seen earlier for the individual activity, right? So what the government is trying to achieve is that more patients go to the private sector to have their chronic diseases treated. And one of the ways is that they also want to partner both the public and the private sector, having the family medicine clinic. Right, this is another slide that you can use to answer the question of how you can reduce the long waiting time or the overcrowding of patients in polyclinic. So these are some of the things that are being done in the polyclinic. So some of the groups mentioned about having video consult, which is tapping on the IT capability. So that's a very good answer, because this is something that the government wants to move towards too. And at this point in time that we are talking, it is still at a very initial stage, but that is the way forward, so that we can really enhance the patient experience and also improve the convenience for the patients, and with leveraging technology, possibly the cost for the patient would go down. And also some we talk about clinic appointments for regular follow-up. So those with chronic diseases can have their waiting time to be shortened. And some we talk about having health buddy, such so-called apps that can be used to help patients. Those are acceptable answer too. And the government also says that they want to continue to upgrade other polyclinics. So some of the polyclinics that's been shown here, like Ang Mo Kio, has already been upgraded. And they're also planning a new polyclinic, which is in Punggol. So these are the things that the government are doing in order to develop or redevelop the polyclinic, so that it helps the patients in Singapore in general.